Dr. Horton, you presented a talk at Glaucoma 360 on the telemedicine, the legal and regulatory issues associated. Could you give a brief summary of your talk?
Thanks, Mark. I'd be very happy to, but first I have to mention that as a federal employee, any opinion I express are those of mine alone and do not necessarily represent those of the federal government, Department of Health and Human Services, or the Indian Health Service. My discussion today concern the legal and regulatory aspects of telemedicine, and with a very brief discussion of reimbursement opportunities in this instance for teleglaucoma. I just very briefly touched upon some of the high spots and some of the major regulatory barriers to scalability and sustainability of telemedicine in general and tele-ophthalmology in particular. I mentioned the limitations on by the Stark Act for self-referral. These are restrictions that can limit a provider's ability to surveil for a particular disease entity using telemedicine and then pass that patient to a higher level of care. Self-referral being the big impediment there. And I mentioned certain techniques to make sure that you don't get in trouble with that particular restriction, fair market value charge for equipment and services, and given a patient a list of possible referral doctors. Also discussed privileging and credentialing limitations and some of the recent CMS advantages we have now for what is casually referred to as credentialing and privileging by proxy. This allows a telemedicine site to inherit the privileging and credentialing decisions and materials from the larger distant site that is the site with the telemedicine doctor. So that the originating site, the site with the telemedicine patient, doesn't have to be burdened by those details that have already been performed in a validated fashion at the distant site.
The question is interesting. The growth of telemedicine is being really rapid in the last few years. In fact, this is one of the reasons why Glaucoma 360 has this presentation this year. Do you see regulatory issues hampering the growth of telemedicine?
The major barriers to sustainability and scalability of telemedicine are in fact regulatory. They're not technical. The difficulty is inherent with regulations. They always lag technology. What we need is a process whereby evidence-based, innovative, or disruptive technologies can be brought to market and to the patient in a fashion that doesn't suffer too greatly by the overhead, the burden of regulations. Of course, we don't want to get too far behind it. We need regulations are certainly needed to ensure patient safety, but finding that delicate balance between evidence basis and regulatory latency is important.
Do you see the future regulatory landscape getting worse or better, or as we progress with these technologies?
This is not uncommonly influenced by a political culture, and there is some indication that perhaps the regulatory bureaucracy is becoming more sensitive to the issue of rapidly developing technology, disruptive technologies that can be brought to help patients, and trying to find that delicate balance between managing patient safety and bringing innovation to the patient.
Thank you, Dr. Horton, for your time.
It's my pleasure.